Let's talk about high blood pressure medication, hypertension medication there, right? I'm sure a number of you are on as well. So what does it do? It lowers blood pressure, right? Isn't it? Unfortunately, when it lowers blood pressure, right, it can potentially cause what you call postural hypotension. That means your blood pressure may drop the moment you stand upright there, right? And that has happened for a number of my patients on this medication there, right? Other potential side effects is biochemical or nutritional, right? For example, this class of drug, the ARBs, all right, angiotensin inhibitors, right? Basically can increase the potassium level, all right? Diuretics can reduce water-soluble minerals like your potassium, calcium, magnesium again, and the water-soluble vitamins, vitamin Bs, and your vitamin C as well there, all right? So for those of you who are on this particular class of drugs, okay, be very careful of your electrolytes there, okay? Now, it can cause metabolic issues like increased blood sugar level. And this holds true, especially for this class of drug called beta blockers, right? Like atenolol, right? Respiratory issues like dry cough, like your ACE inhibitors, okay? Can worsen your asthma. For the beta blockers, can cause cardiovascular side effects, like reducing heart rate there. And when that happens, it can cause dizziness, even fainting as well there. Right? And this can happen when you exercise. When you exercise, your heart rate goes up for a good reason. You want to increase blood flow, isn't it? All right. But if you're taking a medication, a beta blocker, it prevents increased heart rate. And therefore, it can cause this problem of dizziness and even fainting. And calcium channel blockers can cause leg swelling or leg edema. All right. Okay. So if you want to improve your cardiovascular health, okay, besides taking medication, what other things can you take? What are supplements there? Like, so omega-3 fish oil is one of them. The benefits I've talked about. Coenzyme Q10 I've just talked about, okay? Now, another thing you can take is astaxanthin, and another one is pycnogenol there, all right? So let me talk a bit about astaxanthin. Astaxanthin is basically the reddish pigment which gives marine life the color. Right? Do you know why the lobster, the prawns are red, have got a reddish hue to it? Well, it's because of the reddish pigment called astaxanthin. Astaxanthin is a powerful antioxidant there, all right? And this astaxanthin is also found in other marine life like the microalgae, all right? And this is the most abundant source of astaxanthin. Okay? Astaxanthin is a powerful antioxidant. Right, it's 6,000 times more powerful than your vitamin C. All right, it's a super antioxidant, in fact, astaxanthin. And then numerous studies have shown that astaxanthin has got cardiovascular benefits, helps to improve muscle endurance, especially for athletes, right? And helps to protect against anti-aging as well, too. There, all right. So astaxanthin is great across the board for everybody there. All right. So what are cardiovascular benefits? Well, it can help to maintain normal cholesterol levels. Okay, it helps to actually reduce triglycerides and to increase the HDL level. All right, that's what we want there. Okay, astaxanthin can also promote a healthy blood flow to and from the heart, supports the delivery of the nutrients and oxygen to the cells, to the tissues there. All right, and it also remove the waste products away from the cells there. Okay. It helps to maintain normal blood pressure. It can protect the LDL, which is supposedly the bad cholesterol, from oxidation, right? Okay. Because like I said earlier, is the oxidized LDL, which are bad there, all right? Oxidized LDL, a whole lot more sticky, can stick to the endothelial lining of our blood vessels, right? So astaxanthin is great for our overall health. So cardiovascular benefits, visual benefits, skin health benefits, anti-aging benefits there, right? And I take my astaxanthin from these two particular products there, okay? The prime astaxanthin or the isotonic astaxanthin there, right? The benefits are it helps support cardiovascular health, promotes healthy blood flow, all right? Therefore supporting delivery of nutrients and oxygen to the tissues and organs there, and also promote the waste of removal waste products there, right? And as mentioned earlier, it's a powerful antioxidant there, all right? Imagine 6,000 times more powerful than your vitamin C. So what makes the prime astaxanthin and the isotonic astaxanthin unique? Well, it uses the ester-real astaxanthin. All right, now ester-real astaxanthin, to me, is the gold standard of all the astaxanthin in the market today. All right, all the products that shows the benefits of astaxanthin uses ester-real astaxanthin. Now, ester-real astaxanthin is derived from algae, not from shellfish. Therefore, people who are allergic to shellfish can use ester-real astaxanthin there. All right, now, ester-real astaxanthin is synonymous with quality and stability there. All right, research has shown that ester-real astaxanthin rank among the purest and the most powerful antioxidants of all today. Okay, and it comes in 6 milligram serving. And this is important because all the studies which shows the benefits of using astaxanthin uses typically 6 milligram serving at the very least there. All right, at least 6 milligram. So we want to use the correct dosage if you want to derive benefits from the supplement that we are taking there. All right. Okay, so astaxanthin is a powerful antioxidant. So this isotonic astaxanthin is vegan, gluten-free as well. There it comes in convenient packaging there, ready to go stick packs there. All right. And the isotonic astaxanthin comes in isotonic delivery system, maximizing absorption and bioavailability. All right. Now, I talk about pycnogenol. Now, pycnogenol is, I'm sure some of you have heard of it. Well, yes, it's a pine bark extract, but it's not just any ordinary pine bark extract. It is the gold standard of all the pine bark extract there. All right. Okay. This particular pycnogenol is a proprietary brand of pine bark extract, and they are derived exclusively from particular southwest part of France there. All right. And the area is these trees are grown in an organic environment there, all right? These trees are tall or majestic there, all right? Sorry about the noise there. Okay, so pycnogenol is a powerful antioxidant as well too, all right? But studies have shown that it helps to improve blood flow, all right? It increases the endothelin-dependent vasodilation up to 32%. That's huge there. It can help to maintain blood pressure as well. It can help to reduce blood pressure by much of 5% or so there. It can help to improve the cholesterol levels as well too, reducing the LDL and improving your HDL there, okay? Now, pycnogenol has been shown to inhibit abnormal platelet aggregation there. This helps to prevent abnormal blood clots from forming there. Pycnogenol has been shown to help to improve kidney function, all right? Pycnogenol, okay, has been shown to reduce the amount of protein leakage as well. I know because I use it for one of my patients, and after several months of using a pycnogenol containing a product called OPC3, all right, his protein leakage went down quite significantly there. All right, pycnogenol has been shown to reduce the progression of atherosclerosis. That's big. All right, so pycnogenol has been shown to improve the health in people with metabolic syndrome. Basically, what people with metabolic syndrome have got an increased risk of cardiovascular disease and diabetes there, all right? So if you have got this central obesity, in other words, you look prosperous, all right? Okay, that's not good, all right? All right, okay, because it's one of the factor in metabolic syndrome there, all right? Or you've got high triglyceride level, you got low HDL level, you got elevated blood pressure, all right, or you got a high fasting blood sugar level. Well, you've got 3 out of 5 of these criteria. Well, you have got metabolic syndrome, and like I said, that's bad news. You have increased risk of diabetes and high blood pressure there, all right. But guess what? Pycnogenol has been shown in studies to improve all these parameters there. Okay. All right, so one of the products which I like very much, okay, and it contains this pycnogenol, the gold standard of all pine bark extract is this isotonic OPC3. I take it every day myself there, all right? So OPC3 contains powerful antioxidants called OPCs, all right? Called oligomeric proanthocyanidins there. These are the class of bioflavonoid antioxidants, right? And these OPCs comes from 3 sources there, all right? From grape seed extract, from grape skin extract, and of course, not to mention the pine bark extract pycnogenol there, all right? So it contains powerful antioxidants called OPCs, right? And your pycnogenol. So what can this isotonic OPC3 do? Well, basically, as I said, it provides antioxidant support, helps to mop up the free radicals in your body, reducing your oxidative stress, okay? It helps to promote cardiovascular and joint health there. It helps to maintain healthy cholesterol, blood sugar levels, helps to support blood vessel function and healthy complexion there. All right, this is a particular study done on OPC3, okay? This particular study shows that the individuals with metabolic syndrome, which I just talked about, all right, have all the criteria of their metabolic syndrome improve after taking OPC3 over 2 months there, right? So what improved? Well, their blood pressure improved, their total cholesterol improved, the fasting sugar level also improved, and then the endothelial function improved as well. And they measure this endothelial function by checking the neck carotid arteries there, all right? Okay, the skin microcirculation also improved as well. And guess what? This plasma C-reactive protein also improved significantly, declining by more than 50%. Plasma C-reactive protein is a measure of the amount of inflammation in your body, all right? We should have this C-reactive protein as low as possible. The higher it is, the worse it is for you there, all right? And OPC reduces this CRP. That's big, all right? So ladies and gentlemen, all right, don't sneeze there. This kind of products there, all right? It really, really works there, all right? And like I said, I absolutely believe in taking pycnogenol, especially the OPC3, right? OPC3 is isotonic capable. It helps to maximize the absorption and the bioavailability, all right? The absorption into your body there, all right? Okay. Now, the next thing I want